Sheryl Ford is joining us in studio about very important topics. Thank you for joining us today.
Thank you for having me.
Of course. Okay, so a recent study came out by Tulane saying 1 in 9 Louisianians struggle with depression, anxiety. I feel like that's a high number. Why is that?
Yes. Well, we actually also know that our state really has higher than average numbers for relational violence, economic strain. We see things like storm displacement and recovery. And so the body really recognizes those things as trauma and it responds accordingly. When you combine that with the fact that we really do not have enough providers in the state, and especially providers who are doing trauma therapy, it's no wonder people are struggling.
Yeah, so you are a provider, a licensed counselor. How do you see it show up in people's day-to-day lives?
Yeah, when you experience trauma, there really is no area of your life that it can't touch because we get really stuck in that state. And so in addition to the depression, anxiety, you'll see things like relational struggles. It's really hard to connect to people when you're in that fight or flight. You'll also see somatic symptoms and physical symptoms. It's actually not uncommon for a physician to refer someone to therapy as part of their treatment for medical issues.
And so do you have a message to people who are struggling with that?
Absolutely, yes. Well, first I want to encourage someone that these wounds can heal. In the same way that if you go to the doctor, if you break a bone and a doctor can help you, if you see a licensed mental health professional, they can help heal that trauma as well. And so there's a couple of steps you can take. The first, just acknowledging that you're struggling is a big one. Telling someone who's in your life so you're not carrying that alone, and then making the step to create that first appointment with someone. You can actually do incredible trauma therapy through telehealth, so we've made lots of advancements in that area, and I would encourage anyone to reach out and find more information about what that looks like.
And they can find more information on y'all's website. It's there on the bottom of your screen. Thank you so much for joining us.
Thank you for having me.
Of course, stick with us. We'll be right back.